Meanwhile, the Nigerian Union of Journalists in Osun State has condemned accusations leveled against TVC News reporter in Osun State, Rafiu Ahmed, on his report on the closure of primary health care centers in the state. A statement by the chairman of the union, Ajado Suwasio, and Secretary Adeyemi Abodere indicates that Rafiu Ahmed was doing his professional responsibilities since the reported event was a news conference and not a special report. The statement maintained that the press, in line with Section 22 of the 1999 Constitution, as amended, has the responsibility of holding those in government accountable, and the media in Osun State will not succumb to pressure by public office holders in discharge of its responsibilities.
There is a film academy that...
And special advisor to the governor of Osun State, Adeleke on Public Health, Adekunle Akindele, joins me on the news to clarify that situation. It's good to have you join us on the news at 1. First of all, talk to us about the state of public primary health care centers in Osun State at the moment.
Yeah, thank you for having me. Good afternoon, and thank you for giving me the right of reply. The Osun State primary health care centers are up and running. As I speak to you, the staffs are all in there. The patients are there as well. Last week, Tuesday, precisely, the executive governor of Osun State, Governor Ademola, was the innovation and the upgrade of those primary healthcare centers. Tomorrow, by the grace of God, there will be immunization, HPV, papilloma virus vaccines for our girls between the ages of 9 and 13 in about 18 local governments. The health centers are open, attending to our patients, our people in Osun State. So that's it for now.
And last week we had the Nigerian Union of Local Government Employees, the Osun State chapter, reports closure of some health facilities in the state. Was there a closure at any point in time? Did it affect health services at any moment?
That's a fallacy, and I mean that is surprising, because I just told you that last week the governor was on an inspection visit on Tuesday precisely to 2 local governments, Telemu in Olaoluwa local government and Ido-Osun in Egbe local government, to assess what we are doing in those primary healthcare centers. The Governor Ademola Adeleke, is somebody that is passionate about the health and well-being of our people. And don't forget the fact that the primary healthcare centers is the closest to our people. We have, of course, 3 layers of healthcare delivery system: the primary, the secondary, and of course, the tertiary. The primary healthcare centers, about 70% of our people, that's where they visit. And besides the regular, the routine antenatal visit, they do other, they provide other services like immunizations that I've said earlier on, and of course attending to the aged, those ones that have some non-communicable diseases like hypertension and diabetes. The governor takes the health of our people very seriously in Osun State. As I speak to you, we've renovated and upgraded about 200 health centers, primary center. The fulcrum of primary care delivery system is the health center. 7% of our visits of our patients visit the health center. Let me tell you, when the governor came on board, he discovered that a lot of our pensioners, because of the fact that the previous administrations were unable to pay pensions were paying half salaries to our pensioners. They never had the wherewithal to visit those health centers. All our pensioners in Osun State have been enrolled in the health insurance scheme.
All right, Dr. Akindele. Right, I know you can yes. You can go on and on about that, but are you saying that the Union of Local Government Employees that came out to give the public an information about the closure of health facilities did not see correctly? And there is another story. Are you saying that that was false information that they put out to the public?
It is absolutely false. Absolutely false. For what I know, it's only the secretariats across the state that are not working, and it has to do with the imbroglio that arose from the local government issues and election. So I mean, the NOGE or the NLC, in their wisdom, they decided that their workers, for their safety, must stay at home to avoid untoward circumstances and situations. And the primary health care centers, as I speak to you, are exempted. They are not involved because that is where our people go to receive Medicare. I said 70% of them are attending those health centers, especially the pregnant women. I want to say to your medium that I was taken aback when I saw that.
Dr. Akindele, from what you have said, this means that TVC did not lie in the first place, because it was what was reported at the press briefing that we also put out to the public. I hope that is clear.
Let me see the essence of I regard the press as the fourth estate, and beyond that I call them at fourth power, not only reporting news and information to the public. They wield a lot of political influence in the society. So if there's any information or any news or any press conference, as it were, from anybody, I mean, it is incumbent on whoever is going to report it in a national television like TVC, I mean, to balance his reportage, to balance his view, to balance his opinion. Let me tell you, for example, I'm seated here as a special advisor of the governor. If I decide to call a press conference and call probably your sister station without involving TVC correspondent in Osun, and I decide to tell them that there's a problem with TVC news in Lagos, in Abuja, or in anywhere, will those people just go to the press? Will they go to the television and go and report it?
Dr. Akindele, I guess that is why you are here, to also give your own side of the story. Perhaps the wrong information which you are claiming was probably from the Nigerian Union of Local Government Employees, which we also have the duty to report it as it is seen. Let's not forget that today we also saw the NLC warning against politicizing local government in the state. I was hoping if you could respond to that. Perhaps that is an issue in Osun State at the moment.
I'm not hearing you properly. Can you come over again?
Right, I was asking you about the fact that the NLC has also warned against politicizing local government employees in the state. And I'm wondering if that is an issue in Osun State.
There's no issue in Osun State. What we are saying is that health as a sector must and should not be politicized. And if there's going to be any information dished out to the public by the press, it must be balanced. I mean, it is incumbent on the TVC correspondent in Osun State, Alhaji Rafiu Ahmed, to at least reach out to top government functionaries.
Oh, we have the information that our reporter there actually reached out to you. You were not reachable at that time to, confirm that information. But I'm sure that we will have more time to continue this conversation. Just to clarify that TVC did not lie in the first place. We reported what we saw. Thank you very much for joining us. That's a special advisor to the Governor, Ademola Adeleke, in Osun State, on public health, Akindele. Thank you for joining us.